here we have a 74-year-old woman who presents with a severe infection, pneumococcal pneumonia, ends up in the ICU, and she has classic features of multiple myeloma. She's hypercalcemic, she has significant anemia, she has lytic lesions on imaging, picked up on the MRI, and also we have serologic evidence with both the paraproteins by M-spike and light chains, and confirmed by bone marrow involvement with 70% plasma cells. So typical presentation of myeloma in a 74-year-old woman with also the feature of translocation 414 making it more than low-risk patient. The risk of multiple myeloma has really evolved over time. We used to use the old Dury-Salmon system. One of the biggest limitations of that is the number of lytic lesions is really very subjective based on how a radiologist might review the imaging. So the more recent staging is really by the international stage, which is based on beta-2 microglobulin and albumin. And so that stratified patients into 1, 2, and 3 with an approximate overall survival of 3, 4, and 5 years, respectively, for 5 years for the low-risk stage 1. The limitation of the ISS is it didn't include molecular information. So the revised ISS includes the ISS, the LDH, and also the molecular findings. And so certain molecular findings are very high risk in many diseases like deletion 17p. She happens to have translocation 414, which we consider to now be intermediate risk for multiple myeloma. So by the revised ISS stage, we would need to look at all of those features to determine her risk status.